Good morning, everyone, and welcome. The purpose of today's session is to provide education about the COVID-19 vaccine so that we all better understand its benefits and the safety. And we're also going to be pointing you to the latest resources of how to register for the vaccine in your area. We've always said that the safety of our team members is our #1 priority. And we have spent so much time over the last few years highlighting our people first philosophy, refreshing our values, and quickly responding to the pandemic with heightened safety protocols across all of our facilities and offices. And to date, we've been really successful in stopping the spread of COVID in our business. And I'm extremely proud of that. I'm so proud of this team for doing your part to help keep yourselves and your fellow team members safe. Thankfully, there are now vaccines available to help add an additional level of safety to people around the world. And I will tell you, we are so fortunate to live in a country where these vaccines will be available and distributed widely over the next year. There are people that are far less fortunate. Our goal here is to get our entire team vaccinated and protected as soon as possible. I will tell you that when the vaccines first came out, I was skeptical. I was skeptical because there was a lot I didn't know. I will also say that over the last few months, I have participated on several calls with industry, science, the government, and medical practitioners. And I will say now that I absolutely will be getting the vaccine as soon as it is available to me. As I reflect on our values, the guiding principles that we use to operate our business, they really reinforce how important the vaccine is, not just to our company, but to our families and our communities. Let's look at a couple of our values. Focus forward. We strive to do things better. Right now, COVID is impacting our labor force in our factories and in our suppliers' factories. It's impacting our entire supply chain. To do things better, we need to have fully staffed factories, and the vaccine is going to help us get there. Come together. We are united and we share information broadly to make us stronger. There's a lot of information that we are going to be sharing with you today to help you understand how we as a team can be stronger with more vaccinations. Act right. We own our part and we consider the impact of our decisions. This business can't support the 1,200 families that are directly counting on us if we can't make and ship products across the globe. There are 85 million households around the globe that depend on our products. And the vaccine is going to help us keep our factories and our operations teams safer. Show love. This is one of my favorites. We care deeply about all who make our work possible. Because we care about you, we want you healthy. We want your families healthy. And the vaccine provides an added measure of safety. I'd like to turn it over now to MJ Kennelly. She is our EH&S manager in Cape May, New Jersey. MJ came to Bumblebee with over 30 years of experience in the EH&S field. She is a licensed New Jersey State Health Inspector. She has a bachelor's of science in biology and a minor in chemistry, both from York College in Pennsylvania. While she was there, her dissertation was on the AIDS virus, and I think that you will see that she has a lot to share with us and a lot of experience in viruses. So with that, MJ, take it away.
Thank you, Jan. So our education objectives today are to go over the safety, what to expect, the technology and the ingredients, a great testimonial from one of our employees who has been vaccinated, and where to get vaccinated in your particular area. There are some key facts about the COVID-19 vaccination. Getting vaccinated can help you prevent yourself from getting sick with COVID-19. And then the second part would be people who have already gotten sick with COVID-19 will still benefit from getting vaccinated because you can be reinfected within 90 days. The COVID-19 vaccines cannot give you COVID-19, and the COVID-19 vaccines will not cause you to test positive because there are no dead or live viral agents in the vaccine at all. The safety of the COVID-19 vaccines is a top priority, not only here in the United States, but across the world. The COVID-19 vaccines are being held to the same safety standards of all vaccines that are used here within the country. And they are closely monitored for safety and side effects by not only the FDA, but the CDC. And we are only using the approved FDA vaccines at this time, which are from Pfizer and Moderna. The COVID-19 vaccination will help protect you from COVID-19. The vaccines produce an immune response so your body can recognize and fight the virus. And those who get vaccinated are protecting themselves and others from serious illness caused by COVID-19. So let's talk a little bit about what to expect before, during, and after the vaccination process. Before, learn about COVID-19 vaccines like you are today with this production that we're putting on, and all of the items that we're going to show you coming up that you can read about. Also, always check with your doctor as to make sure that the vaccine is recommended for you. During your vaccination, they'll give you a fact sheet that tells you all about the vaccine you're about to receive, and you also receive your vaccination record card. This is really important. You will need that for your first and second vaccine, and then showing proof for it in the future. After, you may experience some side effects. These are immune responses because, as we said earlier, there is no COVID-19 virus in the vaccine. So you'll receive some kind of responses. They could be site soreness where you've received the injection. They could be fatigue, a headache, some muscle pain, chills, joint pain, or a fever. You also might want to enroll yourself in a voluntary program called vSafe. vSafe is recommended so that you can introduce what you have experienced through the vaccine on that program, and others can read what has happened after you've been vaccinated. But also the most important thing is, even after you're vaccinated, please continue to use all the measures to protect yourselves and others that we have been using. You want to make sure you wear a mask that covers your nose and mouth at all times. Stay at least 6 feet away from people who don't live with you. Avoid crowds and poorly ventilated spaces. Wash your hands for at least 20 seconds. Sing happy birthday if you need to. And if you can't do that, use a sanitizer. And always clean and disinfect frequently touched surfaces. If you have any questions about the immune response that you have received with the vaccination, call a doctor, a nurse, or the facility or clinic where you had the shot. So let's talk a little bit about the 2 currently approved vaccines. We'll start with Pfizer. Pfizer is 95% effective. It has 2 doses that you receive 21 days apart. It is diluted with sodium chloride, and there are about 36,000 people who received trial participation in this. You need to be over 16 to get the Pfizer vaccine, and the FDA did approve this on December 11th, 2020. The Moderna vaccine is 94.5% effective, and its 2 doses are given 28 days apart. There's no dilution required, and about 30,000 people were part of the trials. You need to be over 18 to receive Moderna, and it was approved on December 18th, 2020. It is important to realize that's what's part of your vaccination card, that if you receive Pfizer first, you may receive a booster vaccine, the second one, from Pfizer. You cannot cross the 2 vaccines. So what's interesting about this vaccine is it is a messenger RNA vaccine. COVID-19 messenger RNA vaccines provide instructions to our cells to make harmless pieces of what is called spike proteins. The spike protein is found on the surface of the virus that causes the COVID-19. So you can see that at the bottom of the screen there, and you've seen it on many, many pictures. COVID-19 messenger RNA vaccines are given in your upper arm muscle, so make sure you choose the arm you don't write with. Once the instructions are inside the muscle cells, the cell will follow instructions and make the protein piece. After the protein piece is made, the cell breaks down the instructions and gets rid of it. Next, the cell displays the protein pieces on its surface. Our immune system recognizes that protein doesn't belong there and makes antibodies. After developing these antibodies, our immune systems have learned how to protect ourselves against further infections. The benefit of the messenger RNA vaccine, like all vaccines, is those vaccinated gain this protection without ever having to risk serious consequences of getting sick with COVID-19. COVID-19 messenger RNA vaccines do not use live viruses or dead viruses and cannot cause COVID-19. Messenger RNA vaccines do not affect or interact with your DNA in any way. The messenger RNA never enters the nucleus of a cell, which is where our DNA, which is our genetic material, is kept. Our cells break down and get rid of the messenger RNA soon after it's finished using its instructions. Many people have looked and said, how did we get a vaccine so fast? Well, messenger RNA technology was discovered over 30 years ago, and it has been being studied for nearly 3 decades. In fact, scientists have been working on coronavirus vaccine since SARS and MERS outbreaks, but the funding did dry up. Funding was reestablished, and look what is accomplished through the funding of science. It made it very fast for us to develop the COVID-19 because we had already done most of the research. Ingredients in the vaccines include messenger RNA, lipids, potassium chloride, monobasic potassium phosphate, sodium chloride, and dibasic sodium phosphate dehydrate, and sucrose. Please check with your physician to make sure that any of those ingredients do not affect any allergic reactions you could have. So what's not in the vaccine? We've all heard it. We've all seen it on social media. But there is no COVID-19 virus in the vaccine. No fetal cells, no human blood or tissue, no egg products, preservatives like aluminum or mercury, no antibiotics, no latex products, no pork products, and most importantly, there are not microchips in this vaccine. The survival rate for COVID-19 is 99%. So most people say, why should I get vaccinated if the COVID-19 infection has a 99% survival rate? Well, COVID-19 symptoms can last for months. They can damage your heart, your lungs, and even increase long-term health problems, even in those who are young. In the heart, there could be lasting damage to your heart muscle, even in mild infections. And in the lungs, you can develop severe respiratory damage. In the brain, COVID-19 can cause strokes, seizures, and Guillain-Barré syndrome, which is a temporary paralysis. At this time, I want to give the screen over to one of our employees who's actually had both phases of the vaccine, 1 and 2, and his name is Steve Mavity. He's the Senior VP Technical Services. He's been in the food industry for over 37 years, and we are so lucky that 15 and a half of those last years have been here at Bumblebee. He is involved in the food safety, food regulatory, and consumer affair programs. Take it away, Steve.
Thank you, MJ. I'm thrilled. I've got my card here to prove that I've gotten the vaccine. I got my first shot on January 18th, and 3 weeks later, a week ago today, I got my second shot. A lot of people ask me why I got the vaccine. It's because I wanted to protect myself, I wanted to protect my family, and I want to protect those that I interact with. Quite truthfully, I was worried that I would not get the vaccine for some time because I didn't fall into the age groups that are prioritized right now. I've had the flu shot for the last 15 years, and that helped keep me healthy. So my expectation is that the vaccine would work and help prevent me getting the COVID-19. How did I get the vaccine? Well, I guess I was lucky. There was too much vaccine thawed one day at a nearby clinic. My wife works in the hospital next to the clinic, and word was passed. I just happened to be picking her up from work, and she let me know that I could come in and get the vaccine. So I got my first shot on January 18th. For my first shot, I had to register. I provided basic health history information, some identification information, had to answer a number of questions related to whether I was experiencing symptoms or had any allergies. All the people there that were waiting for the vaccine were masked and practicing social distancing. I waited for a few minutes after registering and then went to a vaccination station where my temperature was taken, and I was asked a few questions, much like any other vaccine that I've received. I was asked to choose an arm. The nurse gave me the shot. The shot didn't hurt. I was watched for 15 minutes after the vaccination, and on my way out, I set up my appointment for the second shot and received a vaccination card. The process for my second shot was very similar, except I did not have to re-register, as they had my information saved. For both shots, the only thing I experienced was a little soreness at the injection site for a couple of days, just like the flu shot. I also was impressed that I got a text message follow-up several times from the state health department to check on my experience, and then to provide a link to a site where questions could be answered and where I could download a certificate after the second shot showing I'd been vaccinated. Overall, my experience was 5 out of 5 stars, and I'm very glad that I got vaccinated. I know I'm going to still need to wear a mask and practice social distancing, but I'm really happy that I'm protecting myself, my family, and those that I interact with.
Thank you so much, Steve. It really helps us. So lastly, for me, we need to come together to protect ourselves, our family, our friends, our coworkers, and our community. So we're asking, if you can, and when it's time, choose to get vaccinated when it's offered for you. We want to show love and sleeve up, for sure. We want you to take away some information from this presentation and possibly educate your coworkers, your friends, or your family. We want you to show that you received your vaccine by wearing your sticker, your button prominently. Be proud of being vaccinated. You are helping not only yourself, your family, your community, but the world become a safer place. At this time, I'm going to introduce Javier, our Director of Corporate EH&S. He has been with Bumblebee for 6 years, and he has been working in the EH&S arena since his U.S. military time in 2000. Javier?
Thank you very much, MJ, Steve, and Jan, for your presentation. So just real quick, we will be providing guidance through Fishbowl, where you can obtain multiple information here. We will have frequently asked questions through Fishbowl that talks about COVID-19 and the vaccination. We have information as well about the Moderna vaccine and the fact sheet for this one, and also for Pfizer. We do have a couple of videos, 1-minute videos about what to expect. It's a little video about the process of getting the vaccine and going to an actual site. We also have another one, it's 1-minute video about the top 5 facts of the COVID-19 vaccine. On the right side of your screen, you'll have the links available to get your vaccine appointment information through there. So through those links, you should be able to click there, and it'll take you to that website based on the county that you live in. We try to put all the counties that we have most of our people residing on. There is one here that has all other states. If you go to that link, if you're in a state within the US, it'll take you to the actual health website, Department Health website of that state for you to get the information available. Also, if you have any further questions about the COVID vaccine process, we do welcome you to please reach out to your local Human Resources Department. Another thing, we will make this presentation available. It'll be uploaded within the COVID-19 website further down the line, either today or early tomorrow. And we're also working on a translation to Spanish for some of our team members located in our facilities. And with that, thank you, everybody. Appreciate your time and response, and turn it back to Karen.
All right, thank you. So that concludes our presentation today. Thank you, everyone who spoke. And for those of you who have team members who weren't able to make it today, we encourage you to share with them, as MJ said, this presentation and also the resources available on Fishbowl. Thank you, everyone.